Welcome to SE&M Laboratories Lab Post videos. In this video, we will take an in-depth look at how insurance filing works for laboratory testing, with a focus on LabCorp and Sonora Quest. First, let's look at what we don't know. Every insurance company is different. Furthermore, each insurance company has its own unique plans, which vary from company to company, from region to region, etc. These different companies and different plans will have unique criteria for what is acceptable coverage, what are the deductible limits, and what are the contracts with healthcare providers. Some tests that are covered by one lab will not be covered by another. Some tests that are considered appropriate for a given diagnosis by one insurance company may not be considered acceptable by another insurance company. For example, the test homocysteine is covered under certain criteria by Cigna Insurance. However, if that test is billed to a patient who has Aetna, the test will invariably be denied, regardless of the diagnosis used. So ultimately, there is no way we can ever know if a service will be covered by a patient's insurance. It's in bold for a reason. A patient who is told that a test will be covered and then it's not will not be happy with the outcome. It is important to be aware of these variables and approach the patient without giving a false sense of security. Instead, encourage patients to be active with concerns about their healthcare coverage. A patient can contact his insurance company and find out if the criteria are met for coverage before he gets the testing done. Then he can make an informed choice on how to proceed, which is better than dealing with an unfortunate outcome. So, what do we know? Well, there are some universal factors that affect how coverage is determined. The first is whether or not a provider is considered in-network or out-of-network. LabCorp and Sonora Quest, since they are large companies and provide a wealth of testing and are universally accepted by many physicians, are contracted with most insurance companies. Some insurance companies contract with both laboratories, though some only contract with one or the other. This is why SE&M has accounts with both labs, in order to offer the most opportunity for patients who wish to use their insurance. Being in-network is important, and is part of the reason why many of the specialty labs that SE&M uses are not eligible for insurance filing. The second criteria is the presence of an NPI number. The Centers for Medicare and Medicaid Services developed the NPI numbers as a way of creating unique identifiers for healthcare providers. NPI numbers are free to obtain and can be applied for once a physician is licensed. Finally, the CPT codes and ICD codes are evaluated to determine whether the criteria for coverage has been met. This is where the physician has the most influence over the outcome of an insurance claim. It is essentially the language used by insurance companies to describe the claims they are evaluating. It is important to know what you are saying when you are providing these codes, so let's take a closer look at what these codes are. CPT codes, or current procedural terminology, are classifications of medical services. In other words, they are saying what is happening. In regards to lab tests, they often state which test is being performed. Some tests are classified by the analyte being tested. Some tests are classified by the methodology of the testing, and many tests have their own unique CPT codes, such as CPC or CMP. Some tests have multiple CPTs associated with it. ICD stands for International Classification of Diseases, and they are essentially descriptions of the patient. There are ICD codes for symptoms, diseases, exposure events, known personal or familial histories, and for indicating routine medical procedures and examinations. They form the clinical basis for performing a medical procedure. In other words, they are stating why a medical procedure is being performed. Together, these codes paint a picture for the insurance company. What is being performed, and why is it being performed? When ordering lab work, it's a good rule of thumb to examine your order and ask yourself these questions, and answer them using the CPT codes and ICD codes, just to make sure the answer makes logical sense. Let's look at the potential outcomes for an insurance filing and see how these codes can change which outcomes happen for a patient. We'll use lipids as our example. Remember, the client price is what SC&M is charged for the test, and we add a markup so the patient pays what we charge. Since the laboratory is billing the insurance company, however, these prices will not apply. Initially, the laboratory will bill the insurance company the patient price of $102. In reality, insurance companies have negotiated prices just like SC&M. Unlike SC&M, insurance companies can offer a much higher volume of business and therefore will generally have better discounts on more tests. Let's say, for example, that the insurance discounted price is $4. This discounted price only applies for tests that have been accepted. For our first outcome, the claim is both accepted and covered. Accepted means that the criteria for coverage is met. This reduces the cost down to the insurance discounted price. Covered means that the remaining cost is paid for by the insurance company. There are two scenarios where this happens: if a patient has met their deductible, or if the coverage is considered preventative, such as procedures related to annual wellness checks. Let's say a patient goes in for her routine checkup and the doctor orders a lipid. They use the CPT code 80061, which relates to the lipid panel, and they use an ICD-10 code of Z00.00. Her insurance will be billed $102 for the lipid test. This is a procedure that is considered accepted as a preventative procedure. The ICD of Z00.00, encounter for general adult medical examination without abnormal findings, also indicates that the procedure is routine. Therefore, the test will be discounted and paid for by the insurance company. The patient will get a statement from her insurance company that states that $102 has been billed and that she saved $98 by using her insurance. The insurance company paid $4 and she owes $0. The second outcome is that the claim is accepted, but the patient owes some or all of the amount in order to meet a deductible. This is the most likely scenario for an insurance claim. For our next example, a patient is being treated by a doctor because he has hyperlipidemia. The doctor orders a lipid panel, same CPT code, but now with an ICD code of E78.5. The patient uses his insurance and the laboratory bill is $102. This is a procedure that is considered an accepted procedure for hyperlipidemia, and the price is reduced to $4. However, hyperlipidemia does not describe a preventative justification for the procedure, and the patient has not yet met his deductible, so he will be billed for the remaining balance. He will get a statement from his insurance company that states that $102 has been billed and he saved $98 by using his insurance. The insurance company covered $0 and he owes $4. He will then get a bill from the laboratory for $4. Before we move on to the third outcome, let's take a look at what happens if we put the first two examples together. Let's say a patient sees a doctor regularly for treatment for hyperlipidemia, but she is going to the doctor this time for her annual checkup. If the doctor orders the lipid and provides both Z00.00 and E78.5, how will the insurance determine the coverage? The insurance will, in this case, default to the lowest level of coverage, and the patient will be responsible for the remaining charges. The insurance must assume that if hyperlipidemia is used to justify the medical service, then it cannot be a preventative procedure. This may not seem like such a big deal with only $4 being on the line, but as tests are added, this price can get high pretty quickly, especially when it could be $0 if coded correctly. The final outcome is if the claim is denied. When this happens, the patient is billed the full amount of the patient price. This happens when a procedure does not meet the criteria for coverage. It can also happen if an insurance company does not recognize the necessity of the procedure, as discussed earlier regarding Aetna and homocysteine. Let's say a patient sees the doctor regularly due to depression, which would be coded as an ICD-10 of F33.9. However, this time he is feeling weak and has a sore throat, and the doctor decides to swab his throat for a culture. Unfortunately, the physician's EHR auto-populated his previous ICD-10 code of depression, and the doctor neglected to change the code to the patient's symptoms. The insurance will get the claim and determine that the procedure was unwarranted and deny the claim. The patient will get a bill for $102. So let's see how the CPT and ICD created a justification for the test. What is being done? A culture. Why is it being done? Depression. See? Doesn't make sense. Now, let's look at insurance companies that are not eligible for filing by naturopathic doctors. Currently, Medicare does not recognize healthcare performed or initiated by NDs. Any testing billed to Medicare that is ordered by a naturopath will be denied by Medicare, and the patient will be billed the full patient price. This is true with LabCorp because they will go through with billing Medicare for the testing services. However, with Sonora Quest, the story is a little different. Any testing for a Medicare patient performed by Sonora Quest will be flagged as ordered by a naturopath in Sonora Quest's system. These tests will never be billed to Medicare. Sonora Quest will ultimately turn around and bill the physician's office. If a client price has been established with Sonora Quest, those rates will apply. Does this mean that NDs cannot utilize Medicare? Mostly, no, they can't. However, there are some cases where Medicare patients have this option open to them. If a patient has a secondary insurance, LabCorp will be able to bill this once Medicare has denied the claim. A secondary insurance is a private insurance purchased by the patient. Since it is private, the claim will be assessed using the same criteria discussed above. Be careful though. There is another kind of insurance that Medicare patients may have called supplemental insurance. This is not the same as a secondary, though the terms are often used interchangeably by patients. Supplemental insurance companies will only cover services that have been accepted by Medicare. If Medicare denies a claim, then that means that the supplemental insurance will never see it. The other exception is Medicaid. Medicaid is insurance that is funded by the state, awarded to patients due to financial hardships or disability. Since each state has its own plan, the eligibility of coverage may vary from state to state. In Arizona, Access is the name of the Medicaid plan. Access follows Medicare guidelines with respect for eligibility for coverage. Unsurprisingly, LabCorp and Sonora Quest handle these claims in the same way that they do for Medicare. Additionally, Access plans are managed by a number of private insurance companies. These are indicated by the group listed under the Access plan. For example, the Access plan managed by United Healthcare is called APIPA. The plan managed by Aetna is called MercyCare. These different plans require testing be performed by specific laboratories. APIPA must be done at LabCorp. MercyCare must be done at Sonora Quest. Ultimately, this means that some patients will not be able to use their insurance plans.